Hello guys, my name is Dr. Elizabeth Kolawole, and here are my 2 cents on monkeypox. Today I'm going to discuss monkeypox the best I can. Everything I say today is evidence-based, but as we learn more and as the disease evolves, I may release new information as I find it out. So let's get started. First question, what is monkeypox? So monkeypox is a viral zoonotic infection, and zoonotic just means that it is a disease that is transmitted from animals to humans. It causes a rash similar to smallpox, and there are currently 3 strains or clades of monkeypox. Clade 1 was first seen in the Democratic Republic of Congo in the 1970s. Clade 2 was seen in West Africa. The 3rd strain is related to Clade 2, and some have asked for it to be called Clade 3. This is the 2022 strain that we have seen in the most recent European North American outbreak. Second question, where did monkeypox come from? So monkeypox was first isolated in Denmark in the late 1950s from a colony of laboratory monkeys from Singapore that were going to be used for poliovirus research. Since that time, monkeypox has been seen in animals, specifically primates. And in the 1970s, monkeypox was seen as a disease in humans in the Democratic Republic of the Congo. Since the 1970s, monkeypox has been seen in many countries in Africa, usually obtained from small forest animals. In May of 2022, a new outbreak of monkeypox was reported in Europe, and since then, we have seen monkeypox in non-endemic places or in countries in which they were not usually located. On July 23rd of 2022, the World Health Organization declared this outbreak of monkeypox a public health emergency of international concern. These cases were not associated with recent travel to an endemic area or even close contact with a person known to have monkeypox. So as you know, the U.S. has seen thousands of cases of monkeypox, and as of today, but this is not the first outbreak of monkeypox in the United States. Between May and June of 2003, there was an outbreak of monkeypox in the U.S. with 71 confirmed cases in 6 states. That was the first time monkeypox was seen in the U.S. During this time, there was a febrile illness followed by a pustular rash with patients that had come in contact with pet prairie dogs. Third question, how can you get monkeypox, or how is it transmitted? At this time, you can get monkeypox from animal to human and human to human transmission. With animals, if you come in contact with an infected animal's bodily fluids or from a bite, you can get infected with monkeypox. There are 4 ways to get it from a human, so let's discuss those ways. There's direct contact, that is spread through direct contact with infectious sores or scabs on the body or fluids, or close contact with infectious material from skin lesions during sex or close intimate contact, which is the main risk factor. Then indirect contact with fomites. What is a fomite? A fomite is an object or material that is likely to carry infection, like clothes, utensils, and furniture. Things that are fomites that a lot of people do not think about: your credit cards, your debit cards. You handle them, you give them to others to handle, so be very careful. Your cell phone can also be a fomite. Your bed sheets can be a fomite. Also, you can also get it from respiratory secretions. So monkeypox can be spread through prolonged face-to-face contact via respiratory droplets. Even things like shaking bed sheets can lead to infection. The 4th mode that monkeypox can be transmitted through is across the placenta from a mother to her fetus, which can lead to congenital monkeypox. When monkeypox was seen in the Democratic Republic of the Congo, out of 4 pregnant women who got infected. 1 gave birth to a healthy infant, 2 had miscarriages in the first trimester, and 1 had a fetal death with a stillborn that displayed skin lesions that looked like monkeypox. Fourth question, what are the signs and symptoms of monkeypox? So far, most people, if they are infected with monkeypox, they will develop symptoms. Asymptomatic infections are extremely rare. There's a caveat to that. Once vaccinated, you can pass on monkeypox without developing symptoms. So let's get started with an exposure. So you're exposed. How long does it take for you to first notice symptoms? Incubation period ranges from 4 to 21 days. So what are the first symptoms that appear? These symptoms are called prodromal and consist of fever, intense headache, lymphadenopathy, which is inflammation of the pea-sized glands in your head, neck, armpits, and groin, as well as back pain, muscle aches, and severe fatigue. These symptoms usually last up to 5 days. Then there is a rash. Some people will not have a prodrome and they will go straight to having the rash. The rash can be seen on the face, the palms of the hands, the soles of the feet. It can also be seen in the oral mucous membranes, such as the mouth, the eyes, the conjunctiva, the anus, the genitalia, and perianal region. I will place a picture of the rash. The rash can go from bumps to bumps filled with fluid to bumps filled with pus. Eventually, the lesions crust over and then fall off. This can take 7 to 14 days for one bump to disappear. The rash is usually painful, and when it's in the healing phase, can be itchy. Complications of monkeypox vary by strain, but can lead to secondary infections such as pneumonia, sepsis, in which the body's organs begin to shut down, brain infections, and infection of the cornea, leading to blindness. The complications are rare, and usually people have mild to moderate illness that is self-limiting, that goes away over time. Abnormal labs with monkeypox include elevated liver enzymes, increased white blood cell count, a decrease in platelets, and a decreased protein count. In this 2022 outbreak, we have seen odd or atypical signs and symptoms, such as a rash on the genitals, then going to the face, then going to the trunk. In some people, it does not involve their face or extremities at all. Some people have rectal pain, the feeling of having to have a bowel movement, even when there is nothing there, rectal bleeding. So those are some of the symptoms we see in this 2022 outbreak. Like I said, symptoms usually last 2 to 4 weeks, but for some, they may develop severe disease and need hospitalization. With monkeypox, you are infectious up until that last bump crust over. Like I said, infectious until that last bump crust over. Fifth question, how do you test for monkeypox? There are 2 ways to test. You can test for monkeypox DNA using something called PCR, similar to COVID. You can also test for antibodies, also similar to COVID. Sixth question, what are the types of vaccines for it? Okay, so there are 2 available vaccines that can reduce the risk of developing monkeypox. One is called the Modified Vaccinia Ankara, or MVA vaccine. This is called Jynneos in the United States. This vaccine has excellent safety profile, even in immunocompromised people with skin disorders like eczema. This vaccine is administered in 2 doses, 4 weeks apart. It has been approved in the United States to prevent smallpox and monkeypox. Then the other vaccine is ACAM 2000. This is a smallpox vaccine only used in select patients. It has more side effects than Jynneos. You can use these vaccines after exposure within 4 days of exposure and even up to 14 days after exposure. It can be used to reduce symptoms but not prevent disease. I'll say that one more time. It can be used to reduce symptoms, but not prevent disease. Seventh question, are there any treatments for monkeypox? There is a treatment called Takiravomat, and this is only available at this time through the CDC. This treatment inhibits the virus's protein. It was approved for the treatment of smallpox in July of 2018. The side effects include headache, nausea, and abdominal pain, but those side effects were similar to placebo. This is the treatment of choice at this time. There are other treatments, but they have not been tested on humans, so I will not discuss them at this time. This is Dr. Elizabeth Kolawole, and these are my 2 cents on monkeypox.